Many people in my own state believe that health care is a right, R-I-G-H-T, regardless of income, that every American has the right to the best quality health care that the system can offer regardless of income.
Health care is a right, not to anyone vaguely familiar with the Constitution or even to someone familiar with health care. That interpretation of rights is from a Senate subcommittee hearing on ER services that turned into a debate on the philosophy of health care, with Kentucky Republican Senator Rand Paul, a physician, debating Vermont Senator Bernie Sanders, whom you just saw on the screen, on the idea that health care is a right. Our next guest is a physician who testified at that Senate hearing, who was seated in the chair when Bernie Sanders said health care is a right. Dr. Alieta Eck, who founded the Zarephath Health Center, whose mission is to help churches meet the need of health care for the poor, the uninsured, and the underinsured, joins us here in the studio. Dr. Eck, welcome here.
Thank you for having me.
Is health care a right protected anywhere in the Constitution, such that people can demand it from the government and that the government pay for it?
Right. It was interesting that Bernie Sanders, that was the only question he asked me. After I gave this great explanation of how we could save money on health care, he asked me that question, is health care a right? And I said to him, anytime a right becomes another person's obligation, we need to question whether that's truly a legitimate right in the Constitution.
You are a physician. You do run a free health care clinic in an area of New Jersey not accustomed to free health care. And the next town over is a government clinic. Tell me a little bit about yours and how it works and what it costs for free. And tell me about these folks up the block who run a federally approved one on taxpayer dollars.
Our free clinic, we see 3,600 patients per year, and it's funded completely by private donations, or people put money in a little box in the front. They're so thankful for what we do. Everybody volunteers, the physicians volunteer, the nurses, and it costs us $13 per patient visit.
$13 per patient visit. What would be a typical visit that would cost only $13?
Oh, people will come in, they could be diabetics, they could be, have hypertension, they come in with bronchitis, with sore throats. We keep all these people out of the emergency room.
What does the group up the block or up the street do?
Federally qualified clinic. I looked at their Form 990 to see what it was that they were spending money on, because they will say that it costs them $140 per patient visit, and they're looking for taxpayer dollars to fund that.
And what does it cost to run their clinic, and what does it cost to run yours?
Theirs is $14 million. Now, admittedly, they might see 10 times more patients than we see, because we're only open 12 hours a week, but ours is $58,000.
What does this tell you about the ability of physicians, unfettered by government regulation, to provide health care versus those who are willing to work within the system and let the government tell them what to do, and their ability to provide health care? Shall we ask, which is more economically feasible?
It's very, very obvious. When we take care of people, we manage care. And every time I hear about Medicaid reform, they talk about, well, if we put all the people into managed care, we're going to be able to keep them out of the emergency room. That hasn't really worked. People still go to the emergency room. They know there's a doctor there 24/7. Why make an appointment anywhere? But instead, if they would just let us doctors manage care for free, and there needs to be some type of a compensation, maybe indirect. And all we're going to ask the government to do is give us free medical malpractice coverage for our entire practice. That's what we're working up the legislature in New Jersey. If they would give us free coverage...
Would more doctors open free clinics and service people for $13 a visit?
Absolutely. We've got a doctor down in South Jersey, Dr. Robert Valaire, who is running for the legislature in New Jersey, and he is willing to start a free clinic. Many doctors said they would do it in a heartbeat.
We thank you for your good work. We thank you for joining us, Dr. Alieta Eck.
Ladies and gentlemen, Dr. Eck.
Thank you. Yeah, last week I was made the president of the Association of American Physicians and Surgeons, and I got home, my teenage daughter called me Your Majesty. So I said, you don't have to do that. And then she asked for a stimulus to help her with some of her finances. So I said, no, that's not what we do. But anyway, it's a real honor to have that position because it gives me a platform, and perhaps we can get something done in the AAPS to advance the cause of free care for the poor, given by physicians who donate their time rather than a big government bureaucracy that just wastes all the taxpayer dollars. I'm a physician, a general internist in private practice, and I see every patient as an individual. as somebody who I can look at in the eye and just take care of. They're not part of a group. They're not part of a society. They're an individual that needs care. I have electronic medical records, but they're not going anywhere. They're not getting online. And I'm going to pay a price for that, because under Obamacare, they're going to insist that all the medical records go online, or I'm going to start getting docked in what Medicare pays me. And when, in 1963, right before Medicare and Medicaid were started, remember, Medicare is the program when you reach 65, or for disabled people. Medicaid is for the poor. Keep those straight. But they both started in 1965. In 1963, Dr. Edward Annis gave a speech in Madison Square Garden right after JFK made an appeal to thousands of senior citizens who had all been bussed in. He was trying to push for Medicare legislation. Dr. Annis warned against the starting of Medicare and Medicaid. He recognized the dangers, and it was prophetic. He said, "This bill will put the government smack into your hospitals, defining services, setting standards, establishing committees, calling for reports, deciding who gets in and who gets out, what they get and what they don't, even getting into the teaching of medicine, all the time imposing a federally administered federal budget on our houses of mercy and healing." Well, Medicare was not instituted at that time, largely because of Dr. Edward Annis. It was the largest audience ever to watch an address on television. But then the assassination occurred, Lyndon Johnson came in, and in honor of the martyred president, it passed, and we got Medicare and Medicaid. But all the predictions of Dr. Edward Annis have come true. The march toward the complete socialization of medicine has continued. There's been massive overruns, cost overruns, and it has cost wildly more than they ever expected, which is not a surprise. Well, a lot is at stake. If Obamacare isn't ruled unconstitutional, in a few years, the government is going to try to dictate everything I do, and it won't be good for patients. I tell you, I won't put my medical records online, and I will probably have the iron fist of the government come upon me. But let's pray that this doesn't happen. Let's pray that it is ruled unconstitutional, or that the legislature just repeals it. Well, why should I, as a professional with a valuable education and experience, become subject to, in the words of Ayn Rand, men whose sole qualification to rule me was their capacity to spout the fraudulent generalizations that got them elected to the privilege of enforcing their wishes at the point of a gun? I will not let them dictate the purpose for which my years of study have been spent, or the conditions of my work, or my choice of patients, or the amount of my reward. I may not believe in the government guidelines. They're going to have guidelines that if a patient has a certain diagnosis, you first treat with this, and then you give the next medicine, the next one if it doesn't work. And if you skip it or you don't do it, especially when they're looking at our medical records online, they'll know what we're doing. And we could be sanctioned. And there's fines associated with Obamacare. And every patient is different. I treat each patient different. I don't have algorithms that I follow slavishly. Instead, I do the best thing for the individual patient. Well, how do we get there? Medicare was designed for all over 65, Medicaid for the poor. But the ultimate goal was for the taxpayers to demand that they all be involved in it as well, and then we would have had universal coverage, which was really what they wanted. But the people disagreed. In the mid-90s, the AAPS successfully stopped when Hillary Clinton tried to socialize medicine in Clinton Care, or Hillary Care, or whatever we called it. But progressives didn't give up. Government cannot provide health care. It can only take a lot of money from taxpayers, pay a lot of people to fill in forms, sign people up, shuffle papers, and then use the rest of the money to meddle, restrict, coerce, overpromise, and underpay for what it's offering. Doctors holler for higher services, higher fees, but the taxpayers are tapped out. Does the government provide medical care? No. Doctors provide the medical care. And the best way to fund health care is for the people to pay for their own. I like to use the analogy of Jiffy Lube. If you can take your car to Jiffy Lube, you go in there, you get the service, you give them your credit card, and you take care of it. No insurance, no third party. And most of what we do for patients could be taken care of that way. If people can afford to take their car to Jiffy Lube, they could come to see me without any insurance. And if they have something further that they need, I'll send them to somebody that I would send my family to. And then, perhaps then they need insurance. If something big happens, say they break a leg, or say that abdominal pain turns into appendicitis, they need to go into the hospital, that's what we need insurance for. But the purpose of insurance is to protect us from the bigger medical events that might eat into our assets. That's why we buy insurance. And why run a $120 mammogram through an insurance company and make it cost 20% more? It just really doesn't make sense. So we need to be able to buy the policy we want, with the coverage we want, with the deductible we want, from the state we want. That would be the way to get the least expensive medical insurance. So you might ask two questions. Is the provision of medical care the proper role of government? And secondly, if the government is going to facilitate health care for the poor, what's the best way to do it? So what about the poor? Now, they obviously don't have enough money to pay for medical care or insurance, so shouldn't the government step in there? Well, let me tell you about Medicaid. I've been studying it closely, and it's a huge waste of money. New Jersey is the state that I am associated with, so I've studied it, and I could do this for any state, but we spend $10.7 billion on Medicaid in New Jersey. Our whole state budget is $28 billion. Think about it. Now, they'll say, well, if you look on the bottom there, $5.4 billion is coming from New Jersey, the state, and then $5.3 billion is coming from the federal government. And so that sounds like, well, it's half and half, but wait a second, it's the same taxpayers. It doesn't make sense for us to divide that up. $10.7 billion we're spending on Medicaid for the poor. Half of that goes to the elder care, half goes to acute care. But then when you come down, you find out where all the places where it goes. About $2.8 billion is going to Medicaid managed care and the federally qualified health centers. That means that if 20% is administrative, $500 million is paying administrators of Medicaid, while $90 million goes to physicians. It's a phenomenal injustice. And so the patients can't find a doctor to take Medicaid often because the payments are so low. Doctors are feeling the pressure because they end up taking care of the poor anyway, and the taxpayers are being fleeced. It's way too expensive, and people can't find it. So the government has come up with two bad solutions. Medicaid HMOs. They're designed to shift the risk from the states to insurance companies. And governors like Medicaid HMOs because it's a fixed amount of money. They have a certain amount of poor people. They give the HMOs money and can forget about it. But it doesn't work out well because under Obamacare, everybody's going to have insurance, right? People who can't afford it are going to have to be in some kind of program. So that means you're going to take a healthy family of 4 and give them a Medicaid HMO, and you're going to take $20,000, shift it over to a managed care company for people who are healthy, and the chances are they're not going to need a lot of health care that year. It's a waste of money. The second thing that the states have done was set up federally qualified health centers, and this was because they wanted to keep people from yelling that they couldn't find doctors. So they set up these big federally qualified health centers, and they pay hefty salaries. They get money they get $600,000 from the federal government to start up, and then they get federal dollars, they get state grants, they get enhanced Medicaid payments, whatever that means. They get free malpractice coverage by the federal government. They charge the patients on a sliding scale. They take insurance. They get money from all over the place. How do they spend it? They pay a lot of nice salaries. They get hefty expense accounts. In effect, they're competing with the private physicians who are paying the taxes to fund these clinics, and it costs $140 to $160 per patient visit. Politicians give them the money, and one near us just got an extra $1 million. They said they were running out of money, and the politicians don't want to look like they're callous toward the poor, so they give it. Well, is there a better way? And I will say yes, there absolutely is a better way. When Hurricane Floyd came through central New Jersey in 1999, a little building on the edge of our church's property was under 14 feet of water. my husband John Eck and I, a physician, approached the leadership and allowed us to make it into a clinic. Well, volunteers did the work, tore out the walls, configured the rooms, and by the time it was opened in 2003, it was debt-free. All the money we needed was donated, and we got our own 501c3 status. We see patients who are referred by their friends, referred by emergency rooms. They're referred by the nurses in the hospital who discharge a patient who have no doctor on the outside. Referred by hospitalists who have no private practice. I've seen their pre-printed referral sheets. They're referred by local pharmacies, referred by social service agencies, referred by parole officers as the patients are released from prison, referred by judges in family court, referred by the local food bank. We have a support staff that is extraordinary. Volunteering social workers and psychologists. We have a seminary student, medical students. Patients need more than medical care. They need to get connected with people that care. And at the Zarephath Health Center, they do. All the physicians and nurses volunteer. The federal government gives us medical malpractice coverage under the Federal Tort Claims Act. We see 300 to 400 patients a month and are only open 12 hours a week. After 7 years, it was clear that the building was too small. And so the patients would line up an hour before we would open. There wasn't enough room to do the other things that we wanted to do in the clinic. So another building was identified, and work began in January of 2011 to fix it up. It's 5 times bigger, 5,000 square feet. Modular building set up after Hurricane Floyd to serve as a classroom for a K-12 school. The school had closed down. The building was being used by a different group. But the parent organization decided that the Zarephath Health Center could make better use of it. It was located across from its mirror image building where donated clothes and food are handed out. An architect drew up the plans whereby we could keep as many walls as possible, keep the cost way down. He found a local plumber, a local electrician who did the work for their cost, donating their own services for free. Even the building inspector chipped in, and he said his company would paint the walls, the first coat of the walls. He liked the idea of what we were doing. We see patients who've been released from psychiatric hospitals. They come with a prescription for medicines that cost $400 and no way to pay for it. We see unemployed union members. We see single mothers that we connect with support groups. We see alcoholics who are referred by groups in the local church. And we have a program a lot like Alcoholics Anonymous. We're referred by the unemployment office, referred by the Medicaid office. We see people who are living under bridges who have been evicted from their homes, estranged from their families, often by their own bad behavior, but we try to help. And our church has gone from 200 to 2,000 members since we opened the clinic. Not only because of our efforts, but because they like to be involved with a church that cares. We moved everything over in July. And then we had an open house. Here's a big room that we use for teaching. We'll use it for teaching classes. But we moved it in July. We had an open house on August 20th to the 21st. And then on August 27th, Hurricane Irene put the original clinic underwater again, essentially making it unusable. The drywall will need to come out. The electricity is all shot. Everything needs to be replaced. The neighborhood town had 1,000 of 3,000 homes underwater. So we became a focal point for emergency services. Only ours was the building that was left in Zarephath that was still intact. It didn't take on any water. The next week, a large trailer truck brought donated medicines, including insulin meters and test strips to help with the recovery of the people in the towns. But most of all, we distribute the culture of caring, where people can feel they belong. And many former patients are now volunteers at the clinic. What have we learned in 8 years? We've learned that private charity is the best, least costly, most personal way to deliver care. I took a look at the Form 990 of the local clinic. The first column is a federally qualified health center, and their total budget is over $14 million. And when you look at a Form 990, it's online. You can look at any 501c3 charity. Well, they have generous salaries and benefits. Their travel budget is $113,000. Their consultants, $700,000. They paid provision for bad debts, $650,000. It's a free clinic. How could they have bad debts? They have personnel recruitment. It costs them $265,000. And as I said, the cost to provide care, $140,000. to 280 per patient visit. Most of the money comes from taxpayers. Okay, on our side, the Zarephath Health Center, and our budget there was $53,000 that year. Very clean charity. It's real charity. And the cost to provide care, $13 per patient visit, with no money coming from taxpayers. So, here's the solution. Medicaid doesn't pay anything near to the cost for the physician to provide care. We've had difficulty finding physicians. That's why we're only open 12 hours a week. Physicians are small businessmen, and they're really being squeezed. They're being strapped by the programs out there. They're constantly lowering the amount that they pay. So volunteering is kind of the last thing that they want to do. They end up taking care of people in the emergency room, or they just by default, people just don't pay them. Many unnecessary tests are also ordered by physicians because of the malpractice system. So if you see a patient and you haven't ordered every test under the sun, the first time you saw them, they don't come back, they can sue you for that. And it's a totally unfair type of arrangement. So we would do well if physicians would simply volunteer to take care of the poor in clinics such as ours. Say 4 hours a week for primary care, maybe 2 operations a month, or 2 deliveries a month for an obstetrician. It would cost the taxpayer nothing to remove a huge bureaucracy from the taxpayers because everyone volunteers. Baby boomers retiring at a rate of $10,000 a day, and I know we have plenty that would volunteer. We have plenty of nurses in our clinic. We have plenty of support staff in the front. It's the doctors we're having trouble recruiting. If the states would provide medical malpractice protection for their entire practices, the doctors would do this. This would take a huge chunk of overhead away from them and relieve them of the unnecessary burden of worrying about ordering more tests. And they say it's maybe 20% more tests that we order for malpractice purposes. Volunteering in this way would put the doctors back in control and not the administrator to care for poor people. And as the patients transition out of their indigent state, which we're constantly doing, they get jobs, we say, well, you really shouldn't come to a free clinic anymore, come to our office. They do. And they could see the same doctors that they saw in the clinic who took care of them when they were in a hard spot back in their offices. Taxpayers would be the huge winners. And the HMOs and the Medicaid administrators, the trial lawyers might balk, but they had their turn. We can't keep spending $1.40 for every dollar we take in taxes. It's unsustainable. We need to stop thinking of the poor as people entitled to a big government program. Instead, we need to treat them like our neighbors who need help until they get back on their feet. They don't need Medicaid, they need medical care. And who can argue with free? We've done this for 8 years in the Zarephath Health Center. It's a model that works. So where do we stand in New Jersey? We've begun to promote what we call the Volunteer Physicians Protection Act, or the Zarephath Plan. We've gathered a group of very motivated, intelligent people who have thought through all the issues. We have a lobbyist who's passionate and knows every legislator in the state of New Jersey. Legislators in both parties are in full support. We've secured enough votes in the Senate Budget Committee for passage. Our lobbyist is now working with members of the Health and Judiciary Committees. We've gathered support from the community and faith groups, the New Jersey Catholic Conference, the Orthodox Jewish community, and a meeting of black leaders is scheduled for October 10th. We went to the Office of Legislative Services, the nonpartisan office of the governor, where the numbers get crunched. We know there will be tremendous savings. We met with the Medical Society of New Jersey, the one that's affiliated with the AMA. They endorsed our plan unanimously. We went to several Tea Party gatherings, got overwhelming support. And because of one of those, I got invited to come here. They're signing on to the njaaps.org website. We've met with the governor's chief of staff, and our lobbyist has met with the governor's closest legislative advisor. He sees no problem getting the governor's full support. I spoke to a group of about 40 medical students. They're so excited. They're terrified about what's happening to the medical profession. They haven't even become doctors yet. I spoke at a Constitution Day seminar on Obamacare. The crowd heard everything that's bad about Obamacare. It was a really, really depressing type of conference. And then I spoke, and they jumped up and applauded. They were so excited. One Pennsylvania state legislator understood right away. When I get back, arrangements are being made for the president of the Medical Society of New Jersey and I to meet with the New Jersey Senate president, who's a Democrat. And a Democratic senator from South Jersey, a dentist, is in full agreement. The plan is to file legislation right after the November election and push for passage in early 2012. And then we'll move it to New York. We're optimistic. We've reached a perfect storm in our economy. Something has to be done, and we believe that this would be a tremendous step in the right direction. Let's take back medicine. Let's revive primary care and cash practices, clearly the most cost-effective way to care for patients. Let's put patients back in control of their own health. Put physicians as their trusted advisors and the facilitators of the best medical care possible. Let's revive the economy, take Medicaid system off the backs of the taxpayers. And that's how we will make it easier for companies to hire, smaller government, more jobs, more prosperity. There's a lot more, the details going on, like as hospitalizations, we have those all thought out. So it's really a plan that would work. But we can do this. And as Ronald Reagan used to say, it'll be morning again in America. Thanks.